Hi everyone, I'm Dr. Paramjeet and you're watching Dr. Education. Today we are going to talk about the heart. So let's start with angina. You all must have heard this term, angina or chest pain. See, not every chest pain comes from the heart, but a chest pain which is from the heart is the most dangerous and sometimes lethal.
अगर आप भी हेल्थ के बारे में जानना चाहते हैं तो सब्सक्राइब करिए मेरा ये चैनल डॉक्टर एजुकेशन और बेल का आइकन दबाइए ताकि आप आने वाले हर वीडियो का नोटिफिकेशन सबसे पहले पाएं।
Chest pain or discomfort which is from the heart is basically called angina. Now angina occurs because there is not enough blood flow to your heart muscles. So the blood flow is compromised. That's why the muscles start paining. Your heart muscles need oxygen that the blood carries. And angina will happen whenever there is any blockage or any significant decrease in the blood flow to your heart muscles. Angina may feel like a pressure or a squeezing pain or something heavy kept on your chest. It may also feel like a pressure or a pain or burning sensation, something like indigestion. You may also feel pain in your shoulders, arms, the neck or the jaw or even sometimes on the back. All of this may be angina. It depends upon which part of the heart has compromised blood supply. If it is the lower part, the pain can go even to the upper part of the abdomen. So angina is basically a symptom, not a disease. Angina is a symptom of coronary artery disease. We will cover the topic CAD, coronary artery disease, in a different video. The most common heart disease in 21st century is coronary artery disease. And this happens because when a sticky substance called plaque builds up in the arteries, in the walls, inner walls of the arteries. Now, whenever there is a sticky plaque building up in the arteries, slowly things come and stick up to that plaque. Calcium gets deposited and the plaque becomes bigger and bigger and slowly constricting the artery lumen. So slowly the artery becomes smaller and smaller and smaller over time. Sometimes this plaque can burst, and when it bursts, it just acts like a pimple. Yes, just like when a pimple bursts, blood comes out and then stops, because body tries to stop the blood by clotting it, by putting up platelets on it and making a clot. That's the same thing which happens inside the blood vessels. There is a burst in the plaque and there is clot formation. Immediately body tries within minutes to form a clot and stop the bleeding. But already the lumen is small, and if there is a burst in the clot here and we form a clot here, then there is a good chance the artery may be blocked. The artery may get completely blocked, obstructing the blood supply further. That causes chest pain. That causes heart attack. Whenever the blood supply is fully cut, that is heart attack. Whenever there is some blood supply and you start feeling pain, discomfort, that is angina. There are many types of angina, but there are three basic types. First one is a stable angina, which is the most common angina. Remember, the blockage in your blood vessels will not happen overnight. It happens over a period of years, and slowly the blockage increases from 0 to 10, 20, 30, 50, 60, 70, 90%. And when the percentage of blockage is around half, 50, 60, 70, then you start getting symptoms. And obviously, even if there is 50% blockage, blood will still flow further, but when there is a time of increased demand, something like exertion, while you're walking or running, when your heart is beating fast and requires more blood, maybe that time you might not be able to give that amount of blood with 50-60% of blockages to your heart. At that time you feel angina. So this is a stable angina where you only feel pain or discomfort when you are exerting yourself, when you are walking upstairs or when you are running. When the heart is working harder than usual. Stable angina is a regular pattern and rest and medicine usually helps them. But yes, we will need to check the percentage of the blockage by further evaluation. Then there is unstable angina. This is the most dangerous type of angina, and it does not follow a pattern and can happen without physical exertion also, and it does not go away with rest or medicines. It is a sign that you could be having a heart attack soon, or maybe having the initial phase of heart attack. So unstable angina is where you have chest pain or discomfort when you are doing usual work, even while sitting. There is something called as variant angina, but this is rare. It happens when you are resting. There are many other variants of these anginas, like postprandial angina, which means that you might be having chest pain only after having some food. So any chest pain needs to be evaluated further so that we make sure it is not from the heart. So there are 3 tests which you need to know, which are used to diagnose angina and heart attack. If ever you have any such symptom, any discomfort, pain around your heart, shoulder, upper abdomen, neck, jaw, anywhere which you suspect maybe from the heart, you need to do an ECG, electrocardiograph, an echocardiography, that is a sonography, ultrasound of your heart, and the third would be a cardiac enzyme, a troponin levels. These are enzymes stored inside your heart muscles. And whenever there is a slightest amount of damage in your heart, these enzymes will be released in the blood and can be found after 2 or 4 hours of onset of discomfort. So these 3 tests are the primary tests which we need to do. And if in case all these 3 are normal, that does not mean that your heart is normal. No, that just means that if there is a blockage, it is not severe enough. So you might be having less than 50% blockages in your heart, especially if you are having risk factors like diabetes, hypertension, smoking, inactive lifestyle, family history of heart diseases, obesity. So if these 3 tests are normal, the next thing which you need to do is a stress test. A stress test is where we increase your heart rate, heartbeat, and we see that while in stress, whether your heart is able to work properly or not. So you can do stress test by doing a TMT, which just records the ECG at a higher heart rate, or you can do a stress echocardiography, which is better than TMT, or you can even do a stress thallium test, which is the nuclear test where we inject a radioactive thallium. It flows through all the arteries of your blood, and we take images. We take nuclear images that wherever this thallium goes, we can record it, we can know about it. And then we ask you to run. So we know that before running and after running, if there is any decrease in the thallium uptake of your cardiac muscles. So stress tests can be done to make sure whether you have any significant coronary artery disease. Still, if your stress test is negative, even then you cannot be sure that there is 0% blockage in your heart arteries. Because there can be a non-significant 10, 20, 30% of blockage. The only test which can surely tell you the percentage of blockage is angiography, in which we inject a dye, a coloring agent in your arteries and check in X-ray and check under fluoroscopy, and we can see a video image whether there is a filling defect, whether there is any blockage in your heart artery, and obviously the blockage can be quantified in approximate percentages. So coronary angiography is the only test which shows exact percentage, but obviously every single invasive test has a risk of infection, has a risk of bleeding. So these are done only when initial tests show some significant findings. Another thing which you should know is a CT coronary angio. That coronary angiography can also be done by CT scan. Yes, we can do a CT coronary angiography as well, especially if your kidneys are normal. If your kidneys are normal, because in a CT coronary angiography, much more dye is required to be injected right in your veins, and it goes all over in your body. And if your kidneys are having some problem, any dysfunction, that you might land up in a kidney failure situation. So before doing any kind of angiography, kidney function test needs to be done. A lot of variables are involved in all these things. I've just given you an overall idea. So if you feel you have any kind of symptoms relating to these conditions, heart problems, talk to a cardiologist and make sure you get proper evaluation done. I'm Dr. Paramjeet and you're watching Dr. Education. Make sure you follow our channel, subscribe this channel, hit the bell icon so that you can find the next video notification, and do share this channel. Thank you so much for watching.